Computer. Hi, good evening, everybody. Welcome back to another session of webinar with us. I'm Dr. Betty, and I have here Dr. Anaiki, who is from SGH Sarawak General Hospital, from the forensic department. Okay, we actually never learned much about forensic medicine when in medical school, and many of us, or maybe most of us, don't have a chance to do forensic medicine whatsoever after we graduate. So, Dr. Anaiki, can you tell us more about where you graduated from and how did you get into forensic pathology? Where's Anaki? Anaki?
Cannot hear.
Cannot hear? You cannot hear me? He's not here? What happened to him? Oh my God. He disappeared. Anaki? Anaki? Anaki. Let's just start video. Hello?
Hello?
Yeah? Who is that?
Yeah. Okay.
Are you there?
Can you hear me?
I can hear you.
Yeah,
Now.
I'm here.
Okay, but there's no video of you. So I was just asking you, where do you graduate from and how do you get yourself into the forensic pathology? And maybe you can sort out
Okay.
video. Okay, great. Okay.
Can you see me?
Yes, I can see you now.
Hi, very good evenings, everyone.
Yes.
So, thank you so much for inviting me to give the MediChat together with Dr. Betty tonight. I think it's a very grateful and the good opportunity to introduce the forensic medicines to many of us that are not sure about the forensic medicine itself. So I am Dr. Anaiki bin Zaini. You can call me Dr. Anaiki. And currently I'm a forensic medicine specialist at the Sarawak General Hospitals. And actually, I have been working in forensic fields since 2015.
Oh, that's quite a long time.
Can you hear me?
Yeah, I can hear you.
Yeah, but that time is I'm medical officer, but after that a few years in 2018 pursue my master in forensics medicine in UKM.
Oh, okay. So do you mean there are medical officers that are posted to forensic medicine?
Yes, correct. During that times, Sarawak is just developed and spread from the pathology department itself, and
Oh, I
then
see. It's like a
they need.
okay.
Yeah, it's a.
It's a branch of pathology.
Yeah, initially it's a branch of pathology. It's under one unit, but after that they spread and then develop their own unit. So the forensic medicine is another unit.
Oh, now it's different
from
unit.
the.
Okay.
Yes.
So
Yes, it's a different department.
and your master's program is 4 years.
So I'm pursued the Doctor of Pathology Forensics in 2018, University Kebangsaan Malaysia.
And it's 4 years course, right? 4 years course.
Yes, correct. 4 years course.
And how many university offer this pathology, forensic pathology master's program?
So in the local trainings, we have only 2 uni, whether it's a place under University Malaya or UKM.
I see.
Only these 2. Yes, correct.
Okay. So without further ado, maybe you can help us share your slide and tell us more. Because
sure.
your title is so interesting, and I really
Yeah.
don't know. And I don't want to ask you, I want to be surprised.
Sure. Okay. Can see the slide?
Yeah.
Okay. So can I start?
Yes, please. Yes, please.
Okay. So our topic tonight is actually about the forensic medicine. I choose the proverb, seldom say never and seldom say always. I will explain it later.
Yes.
But yes, correct. And then, but for the initial parts, you'll talk about the what is a forensic medicine, and then what is the law of Malaysia, and also if I got times, we will discuss a little bit about the case discussions regarding the relevant forensics issue, and then related to this topic. Okay. Before that, there is no conflict of interest in these presentations. So actually, as we know, that the forensic medicine is a branch of the forensic medicine itself. But the word of forensic actually has been derived from the Latin word, which is a forensis, which is actually implies something pretending to the forum. That you know that's in Rome, actually forum was the meeting place where civic and legal matter used to be discussed by those with a public responsibility. Then thus the word of forensic essentially convey any issue related to debate in the court of law. So from the interactions of medicines and also law, and has emerged the forensic medicine discipline, which is actually is applications of the medical and allied knowledge and expertise toward the administration of justice. In the simple words, we are helping the law to
Come to justice.
yes, to give the to help the court of law in terms of giving the medical knowledge. Okay, so basically in our field, it is a very broad fields. So forensic medicine itself is got two branch, which is a forensic pathology and also clinical forensics. But I will not explain more details about the clinical forensic because this is deals with the living body of patients. And for example, the explanations of the victims of physical or sexual assault or estimations of the age, injury, and mental status. But the main things here, yes, but the main thing is here is a forensics pathology. So forensic pathology, we deal with dead body only. There is a few sub of interest in the forensic pathology that's well known in Malaysia itself. We have a forensic histopathologies, and we have a forensic cardiac pathology, forensic neuropathology, and also a few pediatric forensic pathologies and forensic anthropology. Forensic anthropology is about the bonds, and we give opinions to the forensic elements and forensic human identifications. We also collaborate with the forensic science. In the forensic science, we have a forensic toxicology and forensic entomology. And forensic entomology is a study about the insects. And then forensic ballistic. Ballistic is a firearm. And then because the
Insect,
medicine is
why insect?
the insect is actually, we use the insect life cycle to determine the postmortem interval, death intervals.
Oh,
So
I see. For example, how long he has been dead.
yes, correct, Dr. Betty, yes. But that
Oh
one
my
is under
God.
forensic science, yes. And then the forensic scientists will give opinion in the court also, like the forensic pathologists also.
Oh,
So
you have to know the insect to know the forensic pathology better.
uh, actually it's not the direct under forensic pathology, but it is
Okay.
an element of forensic science.
Oh, I see. Okay, okay.
Yes,
Okay.
but that we work together as the forensic itself is very big. And then apart from the
Okay.
medicines, we have the forensic science also.
Okay.
And
So
then
it's not, okay, I get it.
yes, correct. So, but it's under the medicines, we have our colleague to help with under radiology. We have a forensic radiologist also, and we have a forensic psychiatrist. And then with the some of the cases, we need the opinion from the odontology. We have the forensic odontologist. So this forensic odontology is actually is under dental department. They have their subspecialty in the forensic odontology. In Sarawak, we have one forensic pathologist, odontologist already. But in the Semenanjung Malaysia, we have also, and in the Sabah also we have one.
Oh, not many, huh?
Yeah, not many in the forensic odontologists. They usually help us in the case of disaster victim identifications, in human identifications, because it's a very there's another way lah, to identify the body apart from the DNA, also fingerprints in the forensic odontologists. Okay. As we know, that's the medical legal death investigation systems. Actually, it is umbrella of the term of patchwork of highly varied state and local system for investigating death. So actually, the medical legal death investigation systems is responsible for conducting death investigations and certifying the cause and manner of unnatural and unexplained death. I will explain what is a cause of death, what is a manner of death, what is an unnatural death, and what is an unexplained death later. But the medical legal death investigation system are very widely in the world. They can generally be categorized as police, coroner, medical examiner, or mixed system. But in Malaysia, usually we use the coroner systems. And then the death investigations is a carry broad societal importance for the criminal justice and public health. And apart from that, it provide evidence to convict the guilty and protect the innocent, whether they are accused of murder, child maltreatment, neglect, or other crimes. And it is at civil litigations, such as in the malpractice, personal injury, or life insurance claims. And that investigations are for many aspects of public health practice and research, including surveillance, epidemiology, and prevention program, most often in injury prevention and control, but also in the prevention of the suicide, violence, or substance abuse. And that investigations emerging as a critical important in evaluating the quality of healthcare and the nation's response to the bioterrorisms also. So we cannot run with this law of Malaysia, regardless of where you practice, and the different states will give the different socio cultural or different SOP, but we need to stick with the one law of Malaysians. The important is these three law of Malaysia, which the important one is the Criminal Procedure Code, which is Act 593. And also we have a Penal Code Act 574. And some cases that we deal with the pediatric, we use the Child Act 2001, which is the Act 611 and the regulations. I'll not go details about the law of Malaysians, but we'll focus on the Criminal Procedure Code, which is Act 593, because it's very important in the death of inquiry of deaths. So in the Criminal Procedure Code, which is the special proceedings, inquiry of death, we have a few sections, but the important section, you know, that's in the law is quite a lot of sections. But the important thing is the section 3 to 8 is about the meaning of a cause of death. And the section 3 to 9 is the duty of the police officer to investigate the death. And section 330 and duty of the officer to arrange of a post-mortem examination in certain cases. And Section 331 is actually about the post-mortem examination of the body by government medical officer. It must be government medical officer to perform the post-mortem examinations. Okay, so in the Section 328 is the meaning of a cause of death. Okay, bear in mind that this meaning of cause of death is not for the medical officer definitions or medical personnel definitions. This is actually for the court of law or police to investigate the case, because it's not only apparent cause of death as given by the medical officer during the post-mortem examinations, but it's also matter necessary to enable an opinion to form as the manner of death itself. So it's actually for the court of law use to define the cause of death. It's we go to the what is the medical cause of death definition later, but just bear in mind this is the definition is for the court of law and police to investigate it. So what is the case or death that need to be reported to the police? So it's a fall under Section 329(1), which is the duty of the police officer to investigate the death. What type of the cases that the police need to investigate? So number one is a person has committed suicide, and the death due to the committed suicide. Number two, a person has been killed by another, or by an animal, or by machinery, or by an accident. This is very important, whether it's killed by another person, animal, machines, or by an accident, need to be reported to the police. Or a person has died under circumstances raising a reasonable suspicions that some other person has committed an offense. So another one is the body of that person has been found and it's not known how he came by his death. This is an example of death outside the hospital care. Is another example, like the brought-in death, for example. A person has died a sudden death, also need to report to the police. So all these things is very important to be reported to the police so that the police will investigate the case. But doesn't mean we report to the police, the post-mortem examinations need to be performed. So in under duty of the officer, police officer to investigate the death, the police will decide whether the post-mortem need to be performed or not. This is under their duty. So basically, there is a few steps of medical legal death investigation. It's almost the same when we taking care of the patient. When the patient come, we take the history taking, do examination, and we will send supportive investigations to support our diagnosis. But the extra here, the background circumstances can be from the next of kin, relative, or patient's friends, or the history can be taken from the investigating police officer itself. And apart from that, the special about the forensic medicine, we can go to the death scenes to do visiting and investigation for that to get extra background circumstances. And then the examination is as usual, it is actually post-mortem examinations. We'll go these details later. So what is a post-mortem examination? Everyone says, oh, we need to do post-mortem, we need to do post-mortem, but what is actually is a post-mortem examinations? So post means after, mortem means death. So it's a very simple, it's the examinations after death. So some of the practice, they said is equal to the autopsy, but it's actually is not the similar. Autopsy is actually dissections of the body, which is a part of the postmortem examinations. But we can some of the dictionary also said is necropsy. Necropsy is the examination of the dead body. This one is equal to the postmortem examination, but the word is usually is interchangeably used. So, but basically, postmortem examinations, we have two types. One is a clinical postmortem examinations. Another one is medical legal postmortem examinations. So I will explain about the medical legal postmortem examinations. But before that, what is a clinical postmortem examinations? The clinical postmortem examination is nothing to do with police investigations. Actually, this is performed with the consent of the next of kin of the disease. The objective of this postmortem actually to determine the disease causing death, which is to determine, clarify or confirm the clinical diagnosis that remain unknown or unclear prior to the patient deaths. And then some of the cases is to evaluate the efficacy of treatment given, and some is to educate the medical students and doctors or any for medical research purpose, or we want to do research regarding the disease progress, like the COVID-19 last times. We want to know the pathophysiology, that the clinical postmortem examinations can be used as the elements in the investigations to determine the pathophysiology in the COVID-19. And another one is to allow removals of a certain organ and tissue for transplantations purpose. This one is for the organ donor purpose. So medical legal postmortem examination is 100% under forensics. It is an open request by the legal authorities in Malaysia. It is under investigating police officer. So what police officer do, they will give us the Pol 61s. So that's actually is a request for the postmortem examinations to do the postmortem examination. This is examples of the Pol 61 form. This is permintaan pemeriksaan mayat in Malay. So, okay. This is important to know. Because the forensics, they always give definitions, and the confusions often arise in the appreciating all the forensics terms. What is the cause of death? What is the manner of death? And what is the mode of death? And the proper interpretations must be done. And then some of the doctor that is not very familiar in the medical legal field will be misinterpret these term definitions. So what is the cause of death? The cause of death actually it is a injury, disease, or combinations of these two that initiate a trend of the physiological disturbance. So whether it's a brief or prolonged, but at the end it's a resulting in the terminations of the individual life. We have two elements in the cause of death, which one is a immediate cause of death. I will explain and give examples of each later. But what is immediate cause of death is actually the disease or injury present at the time of that cause person's death. And proximate cause of death is the original disease, injury, or events that lead to the string of uninterrupted trends of events. The time interval may be spread over weeks, months, or sometimes even years that eventually lead to the individual's death. For example, okay, the case is actually gunshot to the chest. Then the patients admitted to the ward for the chest injury due to the gunshot. Okay, but in the ward, it's complicated by the septicemia due to hospital-acquired pneumonia. Okay, in these cases, actually, the immediate cause of death is actually hospital-acquired pneumonia or sepsis. But the originals, the proximate cause of death, it is chest injury due to gunshot wounds, for examples. Okay? So we go to the manner of death. So the manner of death actually is referred to the designs or fashions in which the cause of death come into beings. Generally, it can be natural or unnatural. So bear in mind that manner of death in Malaysia or in our law is it is determined by the court of law. But the medical officer or medical personnel can give opinion to assist the court of law or the court of law, so that they will arrive the exact the manner of death. So natural cause a manner of death is actually interruption and on failure of body function resulting from age or disease such as pneumonia, or meningitis, for example, and accidental caused by unplanned events. For example, in car accident, fall from height, or while walking, for example. And suicide is a way a person purposefully kills himself or herself by, for example, by hanging, taking a lot of drugs, or gunshot also can be suicide also. And homicide or murder, death of one person caused by another person. But sometimes manner of death is very difficult to determine and will end up with the undetermined manner of death. Okay. We have the cause of death already. We have a manner of death. So now we go to the mode of death. So mode of death is actually referred to abnormal physiological states that existed at the time of death. So according to the BCHET, is a sum of research, there are three methods of death depending upon the systems most obviously involved. So irrespective of what the remote cause of death may be, these are include one is coma, which is a failure of brain functions. Another number two, it is a syncope, where there is a failure of the heart functions. And number three is asphyxia, where there is a failure of the respiratory system. Okay. So
can you go back to that slide, please?
yes, correct.
And this definition, coma, syncope, and asphyxia, is it a definite? Because from my side, when we talk about syncope, it
Yes.
is not the failure of function of the heart.
It is actually it's not definite definition. It's based on the research by the BCHET, the one.
I see, because it's syncope for us. It's just fainting.
Yes, correct.
It's not failure of function of the heart.
Yes. So it's just conditions where there is this abnormal physiological state occur.
Okay.
So,
that's let me. Okay, I want to. Okay, we go on.
Yes. Okay. So I think we already know about the cause of death, the manner of death. So basically, you have idea. We will discuss the case later. So there is a few relevant forensic issue that's usually highlighted by the medical officer itself or any other public regarding a few things lah. One is a time of death. For example, in the broad in death cases, when is the time of death we need to use or documents for this type of cases? Another one is we'll discuss this later. The other issue is unexplained death investigations, or in the case of refused postmortem examination, what we need to do. And injury descriptions and interpretations, I will not touch more in the injury description and interpretation. This is more to misinterpret or describe the injury. And some of the cases we have is negative postmortem examinations, and determinations of the manner of death is another issue. So time of death, for example, so in the case of broad in death, or we call it a BID. So what is a BID actually? BID is actually any patients or persons who is brought to the emergency department with no sign of life. It defines no sign of life. With no spontaneous breathing, no circulations, and then or sometimes they have the rigor mortis already. Rigor mortis is a stiffness of the body after death, or is a hypostasis or rigor mortis. All this is definite signs, no sign of life. Then, in this type of cases, they don't have the exact time of death. They only have the time when the CPR was stopped. So it's very important here sometimes they need the time of death, but actually is a time of the CPR stop only. So it's not the time of death. The time of death, if we have an eyewitness or when the sign of life, when the disease have no sign of life.
That's a very interesting statement actually, because you see, we as personnel who attend to this patient who has been brought in dead,
Yes,
a lot of times we know he is already dead, but something, especially if it's a young patient, we will somehow attempt CPR, and then
yes,
we will have to sign off the death certificate, and we they will always ask the time of death. So in this case, let's say you are the medical officer in ER, and they say, what is the time of death? Do you
we just
put it?
put, we
Can we,
just
I
put,
don't, if I refuse to put, and people question me, it's not, I can't tell what's the time of death because he was already brought in dead.
yes, correct. So
So
that
I
is
don't
the
want to
answer.
put, I refuse
Yes.
to put.
Yes, this is a good the correct practice. We cannot put the time of
That's
death
right, we
there. Yes,
can't. Now that you have mentioned it, we
yes,
can't.
yes, correct. So we just put the time of the CPR stop. It's not
Yes.
time of death, and then it's the only time of CPR stop or time of the body arrival. If no CPR was performed, you can put the time of the body arrived to the hospital itself, but it's not equal to the time of death because we don't know. We don't know when the disease collapse or suddenly have no sign of life. It's because we don't have the patients and doctor relationships of taking care during in
At
this
that
type of
time.
cases.
Can I ask
Yes,
you, if
yes,
like this is the case, and another case is, of course, we always try to make up a diagnosis, a cause of death in ER.
okay.
We always, so that we don't have to ask the family whether they want to go do a postmortem. It makes everybody's life easy. Is it also right or is it wrong?
Okay, I will discuss about these things
Okay,
later.
okay,
This is under unexplained deaths. Okay,
okay.
okay. I think I will answer you in
Yes.
this next slide. Okay, this is another example. Is almost similar with the case that we don't know the cause of death, and then whether we can give the cause of death or not. So this scenario actually an examples of unexplained death. For example, the death of patient with claimed to be stable while in the ward. For example, for the elective procedure patients who is found dead in the ward, and the cause of death is unknown and it has nothing to do with accidents or criminal element. And these cases should be categorized as unexplained death. But the
Okay, so
problem
this elective procedure, this patient found dead before or after procedure?
before.
Okay.
Yes, if I add after procedure, I will explain another one. It's a
Okay,
fall under whether it's a medical negligence or something
okay.
like that. Okay. Then the problem with the unexplained deaths, you know that's our CPC, Criminal Procedure Code. There is
I
no
don't.
provisions for legal authorities to investigate unexplained death actually.
Oh,
So
in the hospital.
yes, is for the case that unexplained death. Okay. The CPC itself didn't state directly about these things, but the recommendations to give to the attending doctor if the postmortem examination is very necessary, the only way is attending doctor made a police report stating that the cause of death was unknown. So the police will investigate the case, whether the postmortem examinations need to perform or not. Another way, if a next of kin not satisfied with the treatment given and that occur, they can make the police report also. This is a two-way. Whether the next of kin make the police report or attending doctor made a police report to find out the cause of death.
Okay. So if this patient died the same death, means same cause of death, but outside of the hospital, which is a sudden death,
Yes.
is a police case.
Yes, correct. It's a police
Okay.
case, correct.
Yes, but this patient now is in the hospital and he died a sudden death before any procedure.
Yes, correct.
Then it becomes an unexplained death
Yes,
in
it's
the
under
hospital.
unexplained. Yes,
So it's not then a police case.
not.
Just
But
because he died in the hospital.
yes, it's still under the care of the hospital itself lah.
I
But
see.
but the issue here, because it's in other because the unexplained death is not equal with a sudden death. It's not
I
equal.
see.
Yes, it's
Why
not
is it?
equal.
Okay,
The
let's say, I, Betty Tay,
yes,
went into the hospital and I
yes,
want to do, let's say, aesthetic, maybe liposuction 2 days
okay,
from now. So I go
yes,
into the hospital. I said, admit me 2 days earlier. I go
yes,
in, I unpack and I die.
yes,
Before anything, is it
yes,
not
correct.
that? And I don't have diabetes, I don't have high blood pressure, I have nothing.
Yes.
Oh,
So that one is considered unexplained death. It's categorized under
but if
unexplained.
I had died just at the parking lot or in my
Outside,
house, then it
yes,
will be
it
a
is
police case.
under sudden death, and then it's will need to the police report, and then it's a considered BID. It's the same thing with the case that actually sudden collapse in the clinic, for example, daycare clinic. It is inside the hospital, but it's a daycare clinic. They just do the doing the follow up. Suddenly collapse. It's a consider sudden death, and then is a consider under BID, and then need to the brought to the emergency, and then police report must be done.
Oh, if it's outpatient, it's considered sudden death.
Yes, correct.
Wow.
Because the reasons she come to the hospital actually is not to seek for the what we call the emergency treatment. The emergency treatment. It is a follow up as usual.
Oh, interesting. Okay, we go on.
Okay. So this type of cases, sometimes patients refuse to do postmortem examinations.
No, patient's relatives.
Yes,
Patient
it's
cannot
not patient,
refuse.
patient relative, sorry. Patient relative, the next of kin, refuse to do postmortem examinations. If the case is actually medical legal death, we go back to the legal authorities, which is police. So whether the police will order the postmortem examinations or not is depend on them. We as a medical personnel or in a forensic, we cannot force the police to issue the post 61 to do postmortem examination. It's based on the police judgments and investigations.
I see.
But in some of non-medical deaths, and then the relative don't want to do postmortem, the attending doctor decide the best probable cause of death. But this type of cases actually is more to the under 5 or is a maternal death. And then bear in mind that non-medical cause of death that given by the police should not be used for the medical static by the KKM. And then our suggestions, if this is, for example, in the under 5 mortality, the pediatrician can give parallel or the best cause of death by using the verbal autopsy. We have the multidisciplinary department to sit together and then discuss what is the probable cause of death. But this medical cause of death is only used for the death statistic by the KKM, but not for the death registrations in the Department of National Registry or JPN. Okay?
This one, okay, go on.
Okay. So this one is the Dr. Betty said just now. If the case is actually we doing the some after the procedure or doing the liposuctions during the liposuction suddenly collapse, the death must be reported to the police because it is a suspected suspicious case that might be caused by the medical negligence. The medical negligence can be anything: medication error, misdiagnosis, or death following medical or surgical procedure. And this is categorized as unnatural death. You cannot say it's a natural death. And that can be accidental, although sometimes it can also be a criminal offense under Section 304 of the Penal Code. This is
But all my years, I don't think we actually
actively
report.
report the police, is it?
Of course not. I mean, I am sure, I don't have any, but because I do mainly non-surgical, but I've never met anyone who said,
Collapse
oh,
lah.
huh?
Yeah, but
Unless the colleague or the patient's relative insists.
actually the proper one, so we want to correct the proper one, if this type of cases, we need to do report police. Then it's up to the police whether want to do further investigate, whether want to do postmortem examinations, whether want to get the statement from the attending doctor regarding the case. And then if the attending doctor can give the diagnosis. Actually, it's not about medical negligence. It's all about after we report the police, it depends on the police itself.
Oh, I don't think anyone has reported police.
Yeah, I know that.
I mean, if you operate on a 80-year-old person with, let's say, pancreatic cancer and going for Whipple, and he died
On table.
Okay. The other thing that I would like to say is, okay, I actually made a note of it in my what is that most doctors and most hospitals would hate the term dying on the table.
Yes, correct.
So dying on the table, either in the OT or even in the cath lab, okay, we do not allow that term to be stated. Means if the patient really has problems and is already going to die, we always send to ICU and declare the death there.
Yes.
Okay. And I've noticed that many times with many people.
Yes.
And why is it different if dying on the table and dying after in ICU? Is there a difference?
Not really, but
Not
depends
really,
on
right?
the
If
duration.
you said
Yes.
like this one, any death that should be reported.
Yes, correct. It should be reported regardless of the age lah.
And regardless of whether it's dying on the table or dying in ICU, right?
Yes, correct. Correct.
Wow,
Correct.
this is very scary.
Yes. Then it depends on the police. Sometimes police said it's nothing to do with the medical negligence. Also, it's a very obvious, it's very poor prognosis. The complications is well known. For example, because of the age itself, the probability of the heals the surgery is very low. So sometimes the case will be risk, but the important things here, that this type of cases must be reported.
Oh,
yes.
Okay. Let's go on. I don't think anybody is going to report, but go on. Let's go on.
Yes, yes.
Very interesting. Okay.
Okay. So we go through the main things. Why I use this very famous among the forensics. We seldom say never, seldom say always. It's actually quoted in the Bernard Knight Forensic Pathology textbook. The second edition, fourth edition, they always repeat the same things because there is some limitation in the forensic itself. We go to the what is the limitation? We cannot 100% sure, but the forensic medicines or forensic pathologists, there is a giving opinions. The opinion can be acceptable, but you need to what we call stick with the facts, the medicals or any proof that's regarding your statements. This is very important. You need to stick with the facts. even it's a seldom say never, seldom say always. We're 100% sure about the cases, whether because it is end up with the determine the manner of death apart from the cause of death later. So
I think that statement can also be used for a lot of medical and clinical setup. Means
yes, correct.
yes,
Correct.
means for
Especially if we not doing the investigations or something like that.
yes,
Yeah.
yes, because you see, always say, I've never come across this in my whole entire, means either you have not been seeing enough patients or you're not been performing enough surgery. So
Yes.
yes, and I've always never had any death after surgery. Okay, then you also have not done enough cases or you have not done very difficult cases. Yeah. Okay,
Correct.
very
Correct.
interesting.
Yes. So in the forensic medicine itself also have a limitations. So we go back to the step of the medical legal deaths investigations. So we have a lot of the limitations in this. This is the main factor. Whether it's about the background circumstances, about the examination itself, or about the supportive investigation. Okay, we go to the background circumstances. Sometimes the inadequate history. You know, that's the history we take is from next of kin. It's not directly to the disease or patients. So
Sometimes
because
there's
the
no
patients is
witnesses,
already passed
nobody.
away,
Yeah,
right?
yeah.
Then some of the disease actually is unknown. We
Yes.
know nothing, no clue. We don't have any supportive sign and symptom or clinical manifestation. Is just found unresponsive on the bed in these bedrooms. But before that, we're not sure because some of the patients or disease didn't mention to the relative about these conditions, right? And then some of the cases, no eyewitness. And then it's very difficult also. Or inconsistent history. The one say like this, and it's, last time they say okay, the patient is normal, well, but the other friend is said, oh, he got the sudden back pain some more, and then it's associated with vomiting. Is some is an inconsistent history, and then for the scenes visit, that scene visit, sometimes is unreachable that scenes, whether it's a too far or not safe to visit by the medical personnel, so that we don't have extra supportive background circumstances to achieve the a cause of death. So another one is examinations. The examination actually, the body itself, the main factor is a body itself, because we didn't receive all is a very fresh body.
Oh my God.
Sometimes
Okay.
it is a decomposed, so it's very difficult. This is just the we need to examine this properly, and then whether it's a got injuries or not, and all is a body is already decomposed, or the body is a severely burned, it's a chart already. It's very difficult. So it's based on the conditions of the body itself, or inclusive findings. Even it's a fresh body, but we didn't see anything. Is a considered is negative postmortem, or is the finding is not really supportive. And some of the cases actually is a diagnosis of exclusions. For example, is drowning. We know it's a background circumstances is drownings, but all is a non-specific findings. Then after we rule out any that can other than
Okay.
drownings, that is baru that's why that's the only things we can put the drowning as the cause of death, which is a exclusion diagnosis.
Oh, like who? Like Chandler. Chandler.
Yes.
Chandler, so sad. He drowned in his bathtub.
Yeah. But that's very important. Sometimes it's in the bathtub also. You know, that's the some is using the what you call the water heater.
Uh-huh.
It's associated with electrocutions. It's really it's not drowning. It's actually electrocution.
Electrical, yeah, electrical.
Yes, it's electrical shock
Yes.
during the times, yeah. So it's there's these limitations, but the important thing in the forensic, we need to rule out any suspicious injuries or any forensic elements. This is very important. We are not God also. We are even some of the cases we're not sure what is the cause of death, or is undetermined cause of death or uncertain cause of death. So another one is in the supportive investigation. You know, that's the samples that we took actually is a postmortem sample. Sometimes we don't have any universal range to support the blood already lies, so we cannot. For example, in diabetic ketoacidosis, so we cannot sense the serums for the glucose. But we have another choice. We can send the vitreous humor to see the glucose levels, or it can be supported by the histological findings or urine also. We can sense the histopathological findings. We can see the kidney changes also on, or inadequate investigation in that facility, whether is the investigation is not available or too expensive. For example, in case of young age, 19 years old, 10 years old sudden death, is usually is associated with the genetic disorder, or it is some like we call it a channelomyopathies, is a QT, long QR syndromes or something like that.
You
It's a
can't find anything, right?
Yes, we can't find anything,
Yes.
but it's a very important. We send the genetic study, but
I see.
in
Okay.
our center we don't have
That's the facility to do
yeah,
the
that's facilities.
to do the genetic study. Yes.
Yes, it's very expensive some more,
Yes.
but we need to
But it may be
collect it.
important because you see, this is a genetic disorder, which
Yes.
we need to inform the family to also get tested.
Yes, correct. That
Sometimes
is
it's important.
like retrospective investigations.
Yes.
Is,
Yes.
yes. Yes, correct. Can. That one is can be done. But that is actually the future forensic service letter, whether is we can use the molecular autopsy, like we send other investigation also. Okay. So this is the things. I think is we have 8 minutes, but we can discuss this type of cases also.
Yes.
Okay, this actually is a case of a 61 years old male taxi driver. Whether we want to determine it's natural or homicide case or murder case, involved in a physical altercations with another taxi driver at pump stations because they have some issue. But during the fight, the disease was suddenly collapsed and allegedly died at the scene. The problem is the postmortem examination only reveals non-fatal injury. It's a small lacerations above the left eyebrow and multiple small abrasions of the nose and both knee is consistent with the fall. But this one is not severe enough to cause his death. Then the examination, yes.
Okay.
So the examinations show this is very severe coronary arteriosclerosis, which is actually corresponding to the data because the disease actually underlying ischemic heart disease. So it's very severe occlusions of the LAD and got thrombus also inside the.
So he died of a heart attack.
Yes, but
Oh
the
my
problem.
God!
Okay.
If he didn't have a postmortem, the other guy would be in jail.
But the issue is here, Dr. Betty. I will explain why I want to highlight this case. Okay. So what we give is ischemic heart disease due to the arteriosclerotic cardiovascular disease. But whether the probable related to the physical and emotional stress during the aggressions is under these things. Because the thing is, because the central nervous system and the heart itself is actually neurologically linked, kan? And then the severe acute emotional events can determine alteration in the cardiac physiology, whether it's from the tachycardia itself, in increase in blood pressure, and lead to the cardiac arrhythmia and sudden death. And then it come some of the medical examiners come with the terms of murder or homicide by heart attack. So actually, yes, this
cannot. Manslaughter. Yes. So even then, manslaughter is acceptable.
Yes, correct. So even then,
I think not lah. I don't think so. As a cardiologist, I don't think so. I think
but
one has to take in okay, I have had a case.
Yes.
not done by me, but he's a very young man, 42
Yes.
year old. I was in University Hospital, and this
Okay.
guy was going to do an angiogram. Okay, he was then pushed. He was pushed in by a trolley, and they were
Yes.
actually lifting him, okay, from the trolley into the cath lab bed. Okay, and
Yes.
then he collapsed. He collapsed,
Yes.
and
Mm.
he went into VF, and not even a puncture has been done.
Yes.
Line has not even been set. Okay, and he
Okay.
died. Okay,
Yes. Suddenly.
so suddenly, so it is actually, how do I say, it's coincidental. The timing is just, the person was at, this guy fighting with him was at the wrong place at the wrong time.
Wrong time.
Yes.
Yes.
Oh my
That
God,
is
sad.
that is another issue. But bear in mind that manner of death, which is homicide or it is actually natural cause of death, is fall under a duty of the judge or the court of law. It's not under pathologist itself. We just give opinions, the probable, the cause of death, and then but at the end, the manner of death, whether it's murder or not, is based on
Oh,
this one. Is the thing that's the highlight in the sum of the research, and then they use it as the supportive in the terms of manner of death lah.
I
I think,
see. So you can tell the you can say that the death is MI, but
yes,
whether the judge will actually
decide.
decide whether the guy was involved in manslaughter or not.
Yes, correct. Yes,
Oh,
correct. No, that's
okay,
the issue because I want to highlight this case because the in terms of manner of death lah. Huh?
okay.
Okay.
We don't have much time left. We have
Yes,
to move forward faster. Sorry, I
yes.
keep on interrupting.
No, no worry.
Oh,
But
very interesting.
this homicide by heart will not further explain about this. They come out with the criteria, modified this criteria, which actually is a quite old criteria. Then they have revised the criteria to say this is homicide by heart attacks. But they said is there is no fatal injury. Then they can decide this is a homicide by attack. The learning point from this is we need to do complete postmortem examination, include the historical examinations, and toxicology is very essential because as you said just now, failure to properly certify this type of death may result in a failure to appropriate adjudicate this type of cases lah. Huh?
Yes.
Okay. Then sempat lagi tak? Okay. Another one is actually it's a simple case lah. It's not case, we just discuss
Okay.
whether the consequence of chronic substance abuse. So the consequence of the chronic substance abuse such as alcohol cirrhosis, alcohol withdrawal seizures, endocarditis secondary to the IV drug abuse, or emphysema associated with smoking, have been traditionally designated as a natural manner before this. But the arguments here often met that these that are chronic poisoning or they have result from the continuous exposure to the external agents and
Okay.
therefore not natural death.
Okay.
That
But
this
who
is
is to be blamed?
yes, because they argue that there is a sub-intent and to do self-harm. But however, this classification of that as natural, as a long history, widespread acceptance and recognitions that such behavior result in diseases and become part in the person's normal life. But sometimes it often include the psychiatric elements such as dependency or addictive disorder. For
Okay.
these reasons, the classification as normal seems most appropriate. Okay, so we have the natural versus homicide, whether this one is a self-harm or is a natural. So I
Okay.
think
Can
this one
I
is the
ask you
last.
a question?
Yes, correct.
Okay.
Yes, can.
I actually made a TikTok video on it this morning. Okay.
Yeah.
So I have a patient who had a stroke. Okay.
Okay.
She's a lady, and her husband a year ago died because of a massive stroke.
Okay.
Okay. And the reason why he died of a massive stroke is because she thought the husband is already so well, he doesn't need all his medication. So
Okay.
she stopped his blood thinner,
Okay.
and
Yes.
he has atrial fibrillation.
Okay. Understand.
Okay. So because she stopped the medication, he died of stroke. Is it
Okay.
murder?
No, it's not. It's not murder. It's not under self. It's not falls under self intents or to do harm to the
No.
himself, because it's a complications of the disease, the natural diseases. If you
Yes, but
didn't take
she
the
herself,
medications,
she's the one who made the decision. Okay,
yes, understand. Yes.
another case is I had a patient who came actually who is about maybe close to 70, like 70 or early 70. Now
Okay.
this lady is she's not to say educated, but she knows things, she can understand a lot of things. Okay.
Okay.
And then she was diagnosed with stomach cancer. So
Okay.
she was operable, but the family refused for the doctors to explain to her her disease.
Okay.
Okay.
Understand.
And the family then decided that they don't want her to go for the operation.
Okay. Understand.
Okay. We can understand.
Yes.
I cannot understand. I was so mad. Anyway, so she didn't get proper treatment. She didn't go for, and then she later then had intestinal obstruction.
Okay.
Okay. Then eventually she died.
Okay.
Is that also good intention or is it murder?
No, it's not under murder. It's still under natural. Yes, but
I cannot accept that.
yes,
Even,
that's why Dr. Betty, the decisions is actually whether it's a homicide or is a self-harm or is a natural cause, it decided by the judge itself.
yes,
Because
I
in the
know I'm
end,
not the judge,
yes,
but then
yes,
I
yes,
I cannot bring myself to accept this kind
yes,
of
correct, yes, and
behavior.
I understand the things.
It makes me very heartache. Okay, we
Yeah.
have a question by Dr. Geraldine in Doquity.
Yes.
Do you mean if the patient is undergoing treatment and dies, but not related to his illness, it is unexplained? She's talking about just now when you said that the patient has been admitted for, let's say, a procedure or a surgery,
Okay.
but then before undergoing the exact treatment, he dies. Is it unexplained? It is unexplained, right?
Yes, correct. This is unexplained. So when the cause of death is actually is not confirmed or is not related to the main reasons why the patient admitted to the hospital, and then you think it is it's not related to this disease, and this is not related to the complication of the disease, is fall under unexplained death.
Okay.
It's the same thing.
And Dr. Haji Sharifah said, I think
this one in the chat, is it?
yes.
Yes,
She's
okay.
I think she's maybe not Malaysian. She said, apa di Malaysia setiap cases kematian yang terjadi di RS saya pun tak tahu apa.
Rumah sakit. That one is rumah sakit. Yes,
Anda
it's a
dilakukan
hospital.
medical legal atau dilaporkan ke polisi setempat. Oh, bukan semua kes kematian kan?
Yes, it's not all the case.
Yes.
Not all
Kalau
cases.
kita rasa adalah natural, kita tak payah.
Yes, correct.
Tapi
Kalau
sebenarnya kalau lepas operation sesuatu berlaku, sepatutnya mesti.
Yes, correct.
Sepatutnya mesti kan?
Betul. Where there is a
Oh.
post investigations related. They just want to rule out the medical negligence. Actually, sometimes
That's
it's
what the
nothing to
doctors
do.
don't want.
Yes.
It's very stressful. Okay, Dr. Lai asked, is there any role for imaging in forensic? Can you give an example and the reason behind?
the role of the, because this is actually features of the forensic medicine letter. We have the CT postmortem CT scan. This one is already done in the KL or they did HKL Hospital Kuala Lumpur. They did all the dead body for the postmortem. Before the postmortem was performed, they did the CT scan. Actually, the role is actually some of the cases are infectious. For example, TB. We can see the features of the TB itself inside the CT scan. Even the classified arteriosclerosis also we can see in the postmortem examination.
But this
Postmortem.
CT scan, is it in the CT
Yes.
scan department or is it in the postmortem department?
Okay, now in the Hospital Kuala Lumpur, they have their own
Their
postmortem
own,
CT
okay.
scan. Yes, correct. It's under forensic. It's under
Okay.
forensic building.
It will be so
But
odd. As it is,
but
we can't get an earlier appointment for CT scan in the government hospital, and now we do CT scan for the forensic patient.
yes, actually,
Yeah.
it's a good thing also. Some of the cases, the police didn't offer for postmortem examinations, and before that, the family refused also. Especially it's under 5 cases or it's a maternal death. We want the cause of death, but at least we have a CT scan. Whether there can be rule out any natural cause via the postmortem CT is a good practice. Now, in SGH actually, the plan is we using the live patients CT scan, but
When
that one is after
necessary.
office hour. It's
When
actually after
necessary.
office hour. Where
Oh,
they,
I see. Okay,
yes,
when necessary lah.
yes, when necessary, correct.
Yes.
If you need that lah.
Yeah.
It's not all.
Okay. We have to end here, and I have to say that it is very interesting. This
Yes.
talk. Okay, after listening, Dr. Aiman said after the listening, oh, I kind of want to join forensic department.
Yeah, sure.
Yeah.
We are
Yes.
welcoming all the
Okay.
juniors.
Okay, maybe you can look up Dr. Anaiki and then maybe get a post there.
Yes.
Yes, I'm so glad that, yeah, this is a very interesting talk. I find it very interesting.
Yes. Thank you so much for inviting. Today, I
Yeah.
can introduce our fraternity to other
Everyone else, yes.
everyone
And
else.
also open our eyes and mind to
Yes.
some legal aspect and also what we see, how we see things so differently, yeah.
Yes, correct.
Okay. Thank you very much. And
Thank you so much.
maybe next year we do again.
Yeah, sure.
Yeah. Very
Yeah.
interesting. I also have asked Huang to do it. Okay. I stop
Okay.
recording.